Good day and welcome to this lesson on core concepts in clinical pathophysiology. By the end of this section, you will be able to explain inflammation and identify the main clinical features linked to it, explain infection and differentiate it from inflammation using clinical indicators, describe immunity, innate versus adaptive, and link each to patient responses. Let's begin with a key concept. What is inflammation and how does it show clinically? Inflammation is a protective response that helps the body remove harm and start repair. It can be triggered by infection, tissue injury, ischemia, or immune reactions. The core inflammation mechanisms includes vasodilation, increased vascular permeability, recruitment of immune cells, release of inflammatory mediators. Clinical features inflammation can explain are fever, pain, redness and swelling, elevated heart rate, also known as tachycardia, fatigue and malaise. Inflammation can be helpful, but if it becomes excessive or uncontrolled, it may cause capillary leak, hypotension, and organ dysfunction, so clinicians must recognize when inflammation is becoming systemic. How do we tell infection from inflammation? Infection is a cause that can trigger inflammation, but inflammation can also occur without infection. Some examples of these are injury, ischemia, and immune reactions. Infection often triggers inflammation, which can produce fever, pain, swelling, tachycardia, and fatigue. Having seen how to identify infection from inflammation, let's see how to differentiate using clinical indicators. Inflammation is a protective response with features like vasodilation, permeability, immune cell recruitment, mediators, and signs such as fever, pain, swelling, tachycardia, and fatigue. Infection totals inflammation driven by infectious stimulus, and it becomes higher risk when it starts producing systemic effects such as hypotension, hypoxia, altered mental status, especially when compensation begins to fail. Don't ask only, "Is there fever?" Ask instead, "Is this localized or is it becoming systemic?" That's where risk and escalation decisions come in. Now, what is immunity and what does it look like in patients? Immunity is the body's defense system that supports protection and recovery during injury or infection. The two primary types of immunity includes innate immunity and adaptive immunity. Innate immunity is first-line response. This is linked to early inflammatory response, while adaptive immunity is more specific response that develops with exposure and drives targeted defense. Now we have seen what is immunity and what does it look like in patients. Let's see how immunity links to patient responses. Immune activity contributes to common patient responses such as fever, fatigue and malaise, pain and swelling through inflammatory mediators and permeability changes. Understanding immunity helps you interpret whether a patient's presentation reflects a protective response or whether that response is tipping into harmful systemic effects. In summary, inflammation is a protective body response that removes harm and initiates repair triggered by infection, injury, ischemia, or immune reactions. It works through key mechanisms such as vasodilation, increased vascular permeability, recruitment of immune cells, and release of inflammatory mediators. That is all for now. We shall continue in the next lesson. Thanks for watching. See you in the next lesson.